Question 1. After diagnosis of strep throat in their school-age child, a parent asks the nurse how soon the child can return to school. Which of the following is correct? B. 24 hours after the first dose of antibiotic. Current national and state public health recommendations stipulate that children should not return to school for at least 24 hours after testing positive for group A streptococci and beginning antibiotics. Question 2. When helping a school-age child prepare for surgery, the nurse should anticipate that the child may have concerns about B. Surgery making them appear different from their friends. School-age children are curious and interested in learning, so they are receptive to teaching about their surgery. However, they do have concerns and fears. 1. Surgery may change their appearance and make them different from their friends. 2. Surgery may damage their body. 3. They want to appear grown up, so they may hesitate talking about their fears. 4. They may wake up during the surgical procedure. 5. They may say or do embarrassing things. Infants and toddlers are most fearful of being separated from their parents. Preschoolers may associate surgery or medical procedures as punishment for bad behavior. Adolescents are more likely to want to discuss procedures or their illness without parents around. Question 3. The pediatric ICU nurse is calculating the cardiac output for a 17-year-old male client. His heart rate is 82 and the stroke volume is 70 milliliters. What is the cardiac output? Round to 1 decimal. C. 5.7 liters per minute. Cardiac output, L minute, times HR equals heart rate, BPM, times SV equals stroke volume, ml beat. The result is divided by 1000 to determine the volume in liters. Cardiac output is the volume of blood ejected by the left ventricle per unit time. The volume of blood, stroke volume, is measured over 1 minute. Normal cardiac output in infants and children is 3.5 and 5.0 liters per minute. For adults, the normal range is 4.0 to 6.0 liters per minute. Question 4. Which of the following sweat chloride levels is considered to be the diagnostic confirmation of cystic fibrosis, CF? B and GT, 60 millimoles per liter. The and NBSB, chloride sweat test, and NBSB winking sad smiley or sweat test, is the standard test for diagnosing cystic fibrosis, CF. It may be if a client has symptoms and NBSB, that may indicate CF, or to confirm a positive diagnosis from routine screening and NBSB, of a newborn. Chloride level, mole L and LT, 30 equals unlikely CF, 30 to 59 equals unclear, further testing needed, and GT, 60 equals CF diagnosis confirmed. Question 5. The parent of an 18-month-old phones the pediatric clinic to report their daughter has put a raisin up her nose. What is the nurse's best response? A. Bring her in right away so we can extract the raisin. Children between ages 1 to 3 years old will commonly put a foreign object up their nose. The best option is to seek professional help to remove the object. This prevents the risk of aspiration, as well as complications such as necrosis. At this age, children are not skilled at blowing their noses. Parents or caregivers should not attempt to remove the object using cotton swabs or tweezers. Leaving an object in the nose is not appropriate. Question 6. A parent brings their child to the pediatric clinic after noticing the child is pale, fatigued, and has frequent nosebleeds. The nurse observes bruises on the child's back and inner arms. The healthcare provider, HCP, suspects acute lymphoblastic leukemia, ALL. Which test will confirm the diagnosis? B. Bone marrow biopsy. Acute lymphoblastic leukemia, ALL, is the most common type of cancer in children under 15 years old, accounting for 85 to 90% of all childhood leukemias. Early signs and symptoms include extreme fatigue, weakness, pallor, bruising, bleeding, headaches, frequent infections, lack of appetite, weight loss, bone joint pain, skin rashes. Physical examination will reveal enlarged lymph nodes and spleen or liver. A blood count and peripheral blood smear are often the first tests performed. Most children with ALL will have too many white blood cells and insufficient red blood cells and/or platelets. Many of the white blood cells in the blood will be lymphoblasts, also called blasts, an early type of blood cell normally found only in the bone marrow. Even though these findings may cause suspicion that a child has leukemia, usually the disease can't be confirmed without a bone marrow aspiration and biopsy. Lymph node biopsy is performed to diagnose lymphoma. Question 7. The nurse is caring for a school-age child who had a cardiac catheterization 1 hour ago. The nurse observes the bed and the dressing at the catheter insertion site are saturated with bright red blood. What is the nurse's first action? A. Apply direct pressure above the insertion site. The nurse should first control the bleeding by applying direct pressure above the insertion site. The nurse should ask another nurse to notify the healthcare provider. Obtaining a set of vital signs is important, but controlling bleeding must come first. Dressing reinforcement and linen change can take place after the other steps. Question 8. Which developmental stage is most likely to fear monsters under the bed or in the closet? A. Preschool. Preschoolers, ages 3 to 5, have active imaginations and are learning to pretend. However, they can't always tell what is real and what is not. The scary monsters they imagine seem real. Preschoolers may also fear the dark, large animals, and loud noises, such as thunder. Infants, birth 1 year, can fear strangers, as well as loud noises. Toddlers, 1 to 2 years, can have separation anxiety and people in costumes. School-age children fear real-life dangers, such as bad guys, natural disasters, or getting sick. Question 9. A second-grade teacher sends a student to the school nurse because the student is coughing constantly. The school nurse checks the student's medical history and notes the child has a history of asthma with no medications. Which of the following actions should the school nurse perform first? A. Contact a parent for more medical information. A second-grade student, 7 to 8 years old, is unable to provide accurate medical information. The nurse should contact a parent or caregiver to obtain more medical information. Obtaining vital signs is appropriate, but not the first action. Administering any treatment is not indicated, nor is picking up the child. Question 10. During a prenatal ultrasound, a fetus is diagnosed with an open myelomeningocele. Surgical repair will be performed after birth. The nurse knows that the reason for the surgery is to C. Prevent infection. Myelomeningocele and NBSB is a neural tube defect and severe form of spina bifida, in which the spinal cord and nerves develop outside of the body and are contained in a fluid-filled sac that is visible outside of the back area. These babies typically have weakness and loss of sensation below the sac. It is diagnosed with prenatal blood work, amniocentesis, physical exam, ultrasound, and MRI. Surgical repair is performed after birth. Sometimes, intrauterine surgery can close the defect. After birth, the defect is covered by a sterile dressing. If the myelomeningocele is not covered by skin or a membrane, surgery will be performed within 24 to 48 hours after birth. This is to prevent infection. If hydrocephalus is present, a VP shunt may be placed, but this is not the primary reason for surgery. Seizures are not prevented by surgery. The neural defect cannot be corrected. Question 11. An 18-month-old is diagnosed with scabies after an outbreak at the child's daycare center. What medication can the nurse expect to be prescribed for the child? C. Permethrin cream. The preferred medication is permethrin cream, approved for ages 2 months and up. Human scabies is caused by an infestation of the skin by the human itch mite, Sarcopt scabies and NBSB, Vardot and NBSB, hominis. The microscopic scabies mite burrows into the upper layer of the skin where it lives and lays its eggs. The most common symptoms of scabies are intense itching and a pimple-like skin rash. And NBSB. The scabies mite usually is spread by direct, prolonged, skin-to-skin contact with a person who has scabies. Scabies occurs worldwide and affects people of all races and social classes. Scabies can spread rapidly under crowded conditions where close body contact is frequent. In addition to the infested child, treatment also is recommended for household members and other close contacts. Lindane lotion is not a first-line treatment due to its neurotoxic action. OTC medications are not effective. Question 12. The healthcare provider, HCP, prescribes elemental iron, in the form of ferrous sulfate, for a child with anemia. The prescription is 6 mg per kilogram per day in 3 divided doses. The child weighs 53 pounds. How many milligram will the nurse administer with each dose? Round to a whole number. A. 48 milligrams per dose. 1 kilogram equals 2.2 pounds. To convert the child's weight, 53 divided by 2.2 is equal to 24.09 kilogram. Round to 24 kilograms. Complete the prescription formula. 6 mg 24 kg 1 equals 144 milligrams. Divide by 3 doses equals 48 milligrams per dose. Elemental iron and NBSB is the total amount of and NBSB, iron and NBSB, in the supplement available for absorption by your body. The American Academy of Pediatrics recommends ferrous sulfate for children. Ferrous sulfate has 20% elemental iron. Question 13. When a 2-year-old is hospitalized with Kawasaki disease, KD, the nurse anticipates which of the following treatments? A. Administration of aspirin. Kawasaki disease, KD, also known as Kawasaki syndrome, is a severe illness characterized by inflammation of blood vessels, vasculitis, throughout the body that primarily affects young children and infants. Kawasaki disease is the leading cause of acquired heart disease in children. About 80% of children with KD are under the age of 5. Kawasaki treatment is a rare exception to the rule against aspirin use in children, but only when given under the supervision of your child's doctor. Aspirin is prescribed to treat inflammation, decrease pain and joint inflammation, as well as reduce fever. Children who develop coronary artery abnormalities may be required to continue taking aspirin for 6 weeks or longer to prevent clotting. And NBSB, intravenous immunoglobulin, IVIG, is also prescribed. KD is not contagious and most children recover with treatment. The other options are incorrect. Question 14. A child with severe gastroenteritis is admitted to the pediatric unit after oral rehydration methods are unsuccessful. The healthcare provider, HCP, prescribes intravenous 4 fluids with potassium chloride, KCl. Prior to administering the 4, which nursing action is most important? A. Check the child's urine output. The nurse should ensure that the child is producing urine before administering 4 fluid with KCl. If there is insufficient urine output, the child could develop hyperkalemia. An electrocardiogram should be done, but is not the first action. Offering food is inappropriate, since the child isn't tolerating oral fluids. Serum magnesium is not related to this situation. Gastroenteritis is usually caused by a viral, bacterial, or parasitic infection. Dehydration results from a combination of vomiting, diarrhea, abdominal cramps, fever, and poor appetite. Rehydration methods depend on the child's age and the severity of the infection. Infants are much more likely than older children to become dehydrated and develop serious side effects. Infants who are dehydrated need medical care right away. The American Academy of Family Physicians recommends hospitalization and intravenous fluid for children who do not respond to oral rehydration therapy plus an antiemetic in patients with severe dehydration, i.e., signs of shock or more than 10% dehydration. Question 15. During assessment of a newborn male, the nurse observes hypospadias. Which of the following statements about the condition is correct? C. The urethra opens on the underside of the penis. Hypospadias is a congenital defect in which the opening of the urethra is on the underside of the penis, most often near the tip of the penis. And NBSB. More severe forms of hypospadias occur when the opening is in the middle or base of the penis. Rarely, the opening is located in or behind the scrotum. The condition is diagnosed at birth during a physical exam. Infants with hypospadias should not be circumcised. The foreskin should be kept intact for use in later surgical repair. During the surgery, the penis is straightened and the opening is corrected using tissue grafts from the foreskin. The repair may require several surgeries. Results after surgical repair are good. Question 16. The nurse at an outpatient surgery center is providing discharge instructions to a 16-year-old male who had an uncomplicated repair of an inguinal hernia. Which of the following statements by the client indicates that he understands the nurse's instructions? A. I can't go to physical education class for 3 weeks. Inguinal hernias and NBSB are most common in males. They do not spontaneously heal and must be surgically and NBSB repaired and NBSB because of the ever-present risk of incarceration. Although most clients who have open hernia repair surgery are able to go home the same day, recovery time is about 3 weeks. Discharge instructions include returning to light activity after 3 weeks. Driving can be resumed after 2 weeks. All strenuous exercise should wait until after 6 weeks of recovery. Swelling over the incision is common after hernia surgery. To reduce swelling and pain, instruct the client to place ice or a cold pack on the area for 10 to 20 minutes at a time. Clients should notify their HCP if the incision becomes noticeably red and warm, if a fever develops, if a testicle becomes hard and swollen, or if bleeding saturates the dressing. Question 17. Before administering a dose of inactivated polio vaccine, IPV, to a 5-year-old, the nurse reviews the child's health record. Which of the following will cause the nurse to withhold the immunization? A. A previous anaphylactic reaction to streptomycin. According to the CDC, a history of severe allergic, anaphylactic, reactions after a previous dose of inactivated polio vaccine, IPV, or after taking streptomycin, polymyxin B, or neomycin should not receive IPV. IPV contains trace amounts of streptomycin, polymyxin B, and neomycin, and people who are sensitive to these antibiotics can also have hypersensitivity reactions to IPV. CDC recommends that children get 4 doses of polio vaccine. They should get 1 dose at each of the following ages: 2 months old, 4 months old, 6 through 18 months old, and 4 through 6 years old. Inactivated polio vaccine, IPV, is the only polio vaccine that has been given in the United States since 2000. Egg allergies are not a factor in IPV. Fear of injections and needles is not a cause for withholding vaccinations. Upper respiratory infections are not contraindications for vaccination. Question 18. A graduate nurse is assigned to provide postoperative care for an infant who had placement of a ventriculoperitoneal (VP) shunt. The new nurse's preceptor must intervene when the nurse performs which of the following actions? A. The nurse places the infant on its back with head elevated at a 45-degree angle. Postoperatively, the infant is placed on the unoperative side in either a flat position or on the back with head elevated at a slight, 15 to 30-degree, angle. Raising the head too high can cause rapid CSF drainage, resulting in a subdural hematoma. Postoperative care of an infant or child with VP placement includes 1. Observing for decreased LOC and vomiting. 2. Monitoring for signs of shunt infection. 3. Observing for abdominal distension or discomfort related to paralytic ileus or peritonitis. And 4. Measuring head circumference daily and reporting an increase of more than 0.5 centimeters to the healthcare provider. Question 19. The nurse is assigned to care for a child admitted for diabetic ketoacidosis, DKA. Which of the following nursing actions is most appropriate? B. Monitoring the ECG for arrhythmias. A diagnosis of diabetic ketoacidosis, DKA, requires the client's plasma glucose concentration to be above 250 mg per dl, although it usually is much higher, the pH level to be less than 7.30, and the bicarbonate level to be 18 MEq per L or less. Initial workup should include aggressive volume, glucose, and electrolyte management. Only regular insulin may be administered for. Hypokalemia associated with DKA treatment can affect the cardiac cycle. Fluids and insulin used to treat diabetic ketoacidosis can cause potassium level to drop too low. The nurse should monitor the cardiac status for prolonged QT interval, low T wave, and depressed ST segment, which indicate weakened heart muscle and potential irregular heartbeat. For fluid replacement is necessary to treat dehydration. During DKA, serum glucose is checked Q1 to 2 hours. Question 20. A school nurse notes that a 12-year-old student has frequently been complaining of headaches. Recently, the student has presented to the nurse with episodes of nausea and vomiting. Today, the physical education teacher told the nurse that the student has been having noticeable balance problems. When the nurse notifies the parents, which action by the parents should the nurse suggest first? B. Contact the student's healthcare provider. The nurse should encourage the parents to contact the student's primary healthcare provider. The student is exhibiting some signs and symptoms of a brain tumor. Common signs and symptoms include 1. Headaches, 2. Nausea and vomiting, 3. Sleepiness, 4. Vision, hearing, or speech changes, 5. Personality changes, 6. Balance problems, 7. Seizures. Brain tumors and NBSB are the most common solid and NBSB, tumors and NBSB, affecting children and NBSB, adolescents. After a medical evaluation, the other options may be appropriate. Question 21. Following a surgical procedure, the nurse is encouraging a preschooler to cough and deep breathe. Which method is most appropriate for a preschool child? C. Blowing soap bubbles. Blowing bubbles is the best way to encourage a preschooler, 3 to 5 years, to cough and deep breathe. Every hour, ask the child to take a big breath and blow the bubbles slowly. After the 3rd of May times, ask the child to cough. An incentive spirometer is effective for older children and adults, but can be difficult for a preschooler to learn, and not as fun as blowing bubbles. Blowing on a pinwheel, whistle, or other blow toy can be effective, too. Balloons should never be used, due to the risk of aspiration. Singing a song is not correct. Question 22. Viral infections frequently produce a characteristic rash. All of the following common childhood viral illnesses can be identified by a rash except A. Mumps. Mumps does not cause a rash. The most common symptom of infection is a painful swelling of the parotid glands, called parotitis. Fifth disease causes a red rash on the arms, legs, and cheeks. It's also known as slapped cheek disease. Rubella, also called German measles, produces a red rash on the entire body. Rubella, measles, first produces Koplik spots, then flat, red spots that spread from the hairline down to the feet. Question 23. A 2-month-old infant is receiving total parenteral nutrition, TPN, for short bowel syndrome, SBS, after developing necrotizing enterocolitis, NEC, following a premature birth. The parents ask the nurse if their baby will ever be able to take foods by mouth. What is the nurse's most appropriate response? C. As soon as the gut heals, we can begin feedings by mouth. Short bowel syndrome, SBS, or short gut syndrome, is a condition in which the body can't absorb enough fluids and nutrients because part of the small intestine is missing or isn't working properly. And NBSB. In infants, it can be congenital or the result of NEC. Feedings should start as soon as the gut is healed, to stimulate the bowel and to prevent atrophy. Oral intake depends on the severity of the SBS and other factors. Children with SBS can often eat, but may require supplemental nutrition, such as enteral support. Question 24. EMS transports a 4-year-old child who experienced a drowning after falling into a neighbor's pool. What is the emergency department nurse's first action? D. Suction the upper airway. The nurse should ensure and protect the child's airway to provide oxygenation. Drowning incidents can cause hypoxia with severe consequences. The other actions are important and can be performed after the airway is established. Question 25. The nurse is performing an assessment of a 14-year-old female who is 5 feet 2 inches and weighs 152 pounds. She has a BMI of 26. The girl tells the nurse, "I'm always hungry and thirsty, and my friends tease me because I go to the bathroom a lot." The nurse suspects that the girl has developed D. Type 2 diabetes. The client has likely developed type 2 diabetes. Formerly called adult-onset diabetes, it is now becoming common among overweight teens. Children who get type 2 diabetes are usually diagnosed in their early teens. One reason is that hormones present during puberty make it harder for the body to use insulin, especially for girls, who are more likely than boys to develop type 2 diabetes. And NBSB. Risk factors include being overweight or obese, BMI of 25 or higher, sedentary lifestyle, having a family member with type 2 diabetes, born to a mother who had gestational diabetes, African American, Hispanic Latino, Native American Alaska Native, Asian American, or Pacific Islander. Type 1 diabetes is an autoimmune disease, with the pancreas producing little or no insulin. Diabetes insipidus is a rare of salt and water metabolism marked by intense thirst and heavy urination, unrelated to insulin production. Gestational diabetes is hyperglycemia that develops during pregnancy.